What do testicular cancer stages mean? Imagine trying to understand how a fire has spread in a building. That's similar to what doctors do when they determine the stage of testicular cancer. Staging helps show how much the cancer has grown and whether it has spread beyond the testicle. This information is essential because it guides doctors in choosing the best treatment and predicting outcomes. Testicular cancer stages are usually described using the TNM system, which looks at three main things: the size of the tumor, whether it has spread to nearby lymph nodes, and if it has reached other parts of the body. They also measure specific substances in the blood called tumor markers, which can give clues about how active the cancer is. The stages range from 0 to 3, with 0 being the earliest, and there is no stage 4 in this system. Stage 0 is also called carcinoma in situ. This means abnormal cells are only in the very early part of the testicle, inside the tubules, and have not invaded nearby tissues or spread. At this stage, tumor marker levels are normal, and it is sometimes considered precancer. Stage 1 is when the cancer is still confined to the testicle itself. It is divided into two parts: Stage 1A, where the tumor is only in the testicle without invading blood or lymph vessels, and tumor markers are normal after removal, and Stage 1B, where the cancer may have grown into or through the testicle but still has not spread to lymph nodes or other parts, with tumor markers remaining normal. Stage 2 means the cancer has spread to nearby lymph nodes, usually in the abdomen area called the retroperitoneum. This indicates the cancer has extended beyond the testicle but has not yet reached distant organs. Stage 3 is when the cancer has spread further to distant lymph nodes or other organs like the lungs, liver, or bones. At this stage, tumor markers in the blood are often elevated, helping doctors understand how widespread the disease is. The system also considers for key factors: the size and extent of the primary tumor, whether it has spread to lymph nodes, whether it has metastasized to distant organs, and the levels of tumor markers in the blood. These details come from physical exams, imaging tests, surgical findings, and blood tests. Knowing the stage of testicular cancer is vital because earlier stages generally have better treatment success and prognosis. It also helps doctors decide whether surgery, radiation, or chemotherapy is needed. Just like in other reproductive cancers, such as cervical cancer, understanding how the cancer has advanced is key to effective treatment and recovery. If you or someone you know is facing a diagnosis, it's important to work closely with healthcare professionals. They can interpret the staging accurately and recommend the most appropriate treatment plan. Remember, each person's situation is unique, and medical advice should always come from qualified experts.